I'm Dr. Lyle Fettig, and I'm the current director of the Indiana University Hospice and Palliative Medicine Fellowship, which is based at Eskenazi Health. Our fellowship started in 2005, and I had the distinct honor of being the first hospice and palliative care fellow at IU.
And it started the year I took a sabbatical to go to Kenya. We created a fellowship in medical ethics in honor of my parents while they were both still living, and raised money from family and friends to create a fellowship in medical ethics, which never materialized. The money happened and grew over the course of several years until 2004 received permission from the Graduate Medical Education Office here at IU to start a fellowship in palliative medicine. And then, very significantly, a friendship with Gina and Marilyn Glick led to another major gift, and not to endow a fellowship, but to fund a fellowship over the next 10 years.
I remember as a resident at Indiana University, there was very little palliative care to be offered on campus and in the city and in the state. And largely due to the fellowship, that's all changed in the last many years.
I was an obstetrician gynecologist for a little over 25 years. I've had an interest in end of life for quite a while, even during my practice in OB.
I was fortunate enough to go to school here at IU, so when I was on my wards experiences, it wasn't uncommon for us to consult palliative.
When I originally decided to do a palliative care fellowship, it really was with the intention of learning as much as I could about taking care of patients at the end of their life so I could bring it back to emergency medicine. I was surprised at how much I loved doing palliative care primarily and taking care of patients in the hospital as well as in the emergency department, and so now I do both.
It's interesting. I've thought about my experiences, my formative experiences during the fellowship, and how those experiences have kind of shaped my approach to patient care and my approach to teaching. And one of the things that I wanted to strengthen for myself and enjoy strengthening in others is this sense of connection.
The specialty of palliative medicine is a medical specialty that aims to provide an extra layer of support to patients who are going through serious illness and their family members.
It's learning to peel away the layers to help understand the patients and their families.
It's those issues that don't fall under a diagnosis code.
I ask all of my patients in the emergency department now, what's most important to you? If I could do one thing for you on this visit, what would that be?
From the beginning, our fellowship was a hospital-based program, but also from the beginning, we recognized that it wasn't enough to just see patients in consultation in the hospital, because most of those patients don't die in the hospital. They survive and go home or go to a nursing facility. And so from the very beginning, we have emphasized the need to follow our patients across settings, so outside the hospital. And that includes making available a dedicated half day for our fellows and our faculty to make home visits to our patients.
Our fellowship in the last couple of years has also started to have our fellows in the oncology clinic working side by side with oncology providers on a weekly basis throughout their fellowship experience. And I think this has had numerous benefits for both our fellows as well as the patients that we serve.
When I tell people what I've done and what I'm doing now, a lot of people, their response is, oh, you're just going on totally opposite ends of the spectrum. But I really do feel there's a poetic similarity. The patient is going through difficult symptoms. And so again, I have the opportunity to work with those symptoms and see how we can best manage those symptoms.
It's actually my first month of fellowship, where I had a patient who was facing some very serious heart issues. And he was deteriorating at a pretty rapid rate. And I was really blessed to be able to help him and his wife through a very difficult time. Just a month ago, I was on a new rotation 150 miles away from here. And I walked into the room of a hospice patient, and his daughter was sitting there next to him. All of a sudden she looked up and she said, "It's you." And I was blown away to see it was the wife of the patient I'd taken care of almost 10 months earlier. She stood up, gave me a big hug. She said, "Mom, this is the doctor I was telling you about. We were just saying we wished we had doctors like this to be able to help us through this experience, like you and your team were there to help me through my experience." Moments like that just fill you with such an affirmation of what we're doing actually is making a difference.
And we've had, I suspect, about a half a dozen fellows who have done a special elective in international hospice and palliative care in Eldoret, Kenya. And one of our faculty joins our fellow for a month-long rotation in helping develop a robust palliative care presence in East Africa as part of the IU Kenya program and the Ampath Oncology Institute.
We believe at Eskenazi that any person that walks through the door should receive the same level of care. I think a very unique facet of our program is an intense focus on care of the safety net population that Eskenazi specializes in.
I've always enjoyed kind of being stationed and rooted here at Eskenazi. In large measure, it's because of the diversity of patients that we see. And very happy to know that we're going to have a Spanish-speaking fellow join us next year, which I think will be a great benefit to all of our patients, but especially the ones that are Spanish-speaking.
I'll be serving as the director of an inpatient palliative team at Ball Memorial Hospital in Muncie, part of the IU Health System. And it's a role that I don't know how I possibly could have really aspired to step into without the experience of this fellowship.
I have started doing training programs for our nurses who are interested in what they can do for patients in the emergency department with palliative care. Have started working with residents in the emergency department who are doing rotations or doing research projects. In the future, I hope that every emergency department has a palliative care protocol.
The fellowship has definitely given me some of the tools to deal with the physical needs of the patients that we'll be seeing. But more importantly, I think the fellowship has helped me see better.
For me, one of the best parts of this fellowship was the opportunity to watch the leaders, Dr. Svedig, Dr. Rosario, Dr. Grambelsbacher, and all the other attendings interact with patients.
From my directors who have taught me on a daily basis to those who have made the existence of the program even an option, it was truly a wonderful gift for which I'm very, very grateful. So thank you very much.
Our fellowship is largely dependent on the support of donors, and we've had robust success over the last many years in training several palliative care physicians. And without the Glicks, there's by no means that would have been possible to the degree that we've been able to do that. So thank you very much.